I understand that anytime there's a change, people fear change, even when it's in their best interest. And that's what I see going on right now. I see dental practices being fearful of doing what's right, what's mandated, and what's in their own best interest, which is sharing information with patients.
Welcome back to the Dental Economist Show with me, Mike Huffaker. Today, we're excited to welcome Dr. Bryan Laskin, a trailblazer in the dental technology landscape and the visionary mind behind Toothapps, a solution removing barriers between dentists, their patients, their teams, and their data. Bryan's dedicated over 2 decades to advancing dental practice through innovative solutions, focusing on enhancing interoperability within dental systems. His work with Toothapps has transformed administrative and clinical operations, making dental care more seamless and integrated. He's not just advancing dental technology, he's setting new standards for how dental care is delivered and experienced. Welcome to the show, Dr. Laskin. How are you doing today?
I'm doing well. Thanks a lot for having me. Congrats on the success of your podcast and all the great work that you're doing. Appreciate it.
Oh, well, thank you. It was a pleasure to join your podcast as well in the not too recent past. And so looking forward to this follow-up conversation. I think to start us off today, you've had a really remarkable journey from practicing dentistry to becoming a tech entrepreneur. Could you share a little bit about how your career began and what inspired you to kind of transition towards focusing on dental technology and innovation?
Yeah, thanks. Well, my career began basically through false logic that I had. I was going to become a physician, like some other family members, and I went on rounds with them and realized that I don't have it in me to go to school for 8-10 years to be told by a health insurance company what to do. So I stopped and took a year to figure it out. And every dentist I met was so calm and collected, and I was like, well, I have raging ADHD, so I should go into this profession because it's going to calm me down. Turns out that's not the way the world works. Dentists typically are calm because there's a lot of stress involved with being a dentist. And so I practiced dentistry at a high level for 20 years. And early on, I've always been involved with technology. I love technology. So I got involved with CAD/CAM and CEREC specifically about a year out of dental school, and trained hundreds, maybe probably thousands of dentists on that technology. And then about a decade ago, just complained to the right person at the right time about something. And he said, well, why don't we do it? Why don't we do it the way that you want to do it? And that kicked me off in developing our own technologies. And that's been something that's been, for somebody like myself that is constantly looking to improve and do new things, to be able to have an idea and then put it into action is addictive. So here I am, about a decade later, doing all sorts of different stuff in technology.
And now, was Opera DDS the first technology company that you had founded yourself?
It was. In fact, the very first problem was team communication. I wanted to walk into the hygiene operatory and a list of everything that was going on when I walked in the room. That was the very first problem that I wanted to solve. And we did that. And then I would say, what we're doing with Toothapps, with the communication hub, dentistry is a team sport. And I think that, if you're going to play it at a high level, we have to address the fact that we don't work individually in a vacuum. One of the things that I like to do with our technologies is address needs that other people might not, who aren't from the field, right? Like if you're going to coach the 49ers, right? You're probably, I don't know I don't know much about sports, but I like your hat.
But you're going with the analogy anyway.
I love sports analogies, even though I know nothing about sports, which is problematic, right? Yeah. So I apologize if I take off without a landing here, but I certainly think that the best coaches probably have played the game, right? And I think when it comes to technology, it's the same thing. I think that having practiced dentistry at a high level, being on the leadership team of a DSO for a few years, one of the largest DSOs, you see insights into the industry, as you kind of alluded to before, that other people don't. So hopefully we can solve problems that other people aren't solving, including bringing the team together, because that's what it's all about. If you're going to deliver the best care, It is all about coordinating with your team.
Yeah, so it definitely gives you that unique perspective and probably a depth of understanding as to the problems that are faced in the industry that many that never were chairside or never managing or running offices or working at a high level within a DSO would really truly be able to understand. You've been a very vocal advocate and proponent for data accessibility and interoperability within dental. And in fact, you've been working on writing standards and, you've done a lot of great work. Why is this so important to you?
Well, I mean, bluntly, I think it's the biggest problem we have in dentistry. It's the biggest barrier to innovation. It's the biggest suppressor to quality of care. And it's the biggest chokehold on increasing revenue in dental practices. Everything we do in dentistry, if you just want to talk about revenue, if you want to drive revenue in a dental practice, it requires doing treatment. In dentistry, we don't get paid a lot for diagnostics or talking to people. You have to provide treatment. And in particular, you have to produce treatment that's effective and actually successful. Because if you have a bad outcome, you're not going to be you might drive some revenue, but you're not going to be profitable because you're going to have to give all that money back and then some. So the way we create treatment that's effective is we come to a diagnosis. And that diagnosis, so it doesn't become a misdiagnosis, is all predicated on having the right information. And right now in dental practices, they don't have it. Now you might say, Bryan, what are you talking about? I practiced dentistry for 20 years like you did. I always have the information. Really? When a new patient comes to your practice and you get their information and their records get transferred from the other office, what do you get? The answer is crap. You don't really get anything, right? And that is a chokehold on your practice. You got to waste time and money and energy trying to rebuild information that's impossible unless you had access to that information. Also, this idea of, which I know you're a big fan of addressing too, like, does it integrate with my system? That's an archaic way of thinking. Things should just work together. So if there's a small innovative company, they should be able to leverage whatever technology is going to be best for their patients, for their practice. And that's, really what happened to me with Opera. We had Opera in 30,000 dental practices when I sold it a few years ago. And the biggest problem we had was trying to get access to the record system so that we could do things like paperless forms and recall and all the things that a technology company needs to do. So at every level, from patient to team member to somebody that runs a dental practice or a dentist to DSO to software vendor, along that entire chain, the biggest problem I think that we have in dentistry is not having access to the information to be able to remove the friction to deliver the highest quality of care and increase the production within our practices.
Yeah, and to your point, from a patient perspective, if you're transferring to an office or going to see a new provider and the information is not readily available, like, your treatment and the level of care that you receive can also be affected as well, with the full picture not really being available for your new doctor. Why do you think we ended up in where we are in dental? So, it seems when you're explaining it very logical that yes, like, the data should be available. You should have access to it. The patients should be able to have access to it. You should be able to easily transfer records when there's a patient that's moving. If you're using different systems, it should be available. Like, this is the data within your business that you've built, whether it's an independent practice or a group or a DSO. How did we end up in a space where silos were the norm and where interoperability and really seamless integrations stand out as being kind of revolutionary?
Well, great question. I like the way you presented it, because I think there's really two big reasons. The first reason is how we got exactly how you presented the question. How did we get here? Well, if you think about it, what are our electronic record systems in dentistry? We call them practice management softwares, right? What is a practice management software? Now, I've asked the heads of the largest practice management software companies, and shocker, they didn't have an answer to that question. And here's why. Because how do we get here? Well, at some point, probably in the 80s, somebody looked at a paper chart and said, hey, I can put this thing on the computer. So they put a paper chart on the computer. They said, well, gee, now that there's a paper chart on the computer, I can do things like having a scheduling module and having a billing module. And they started throwing things together that they kind of thought of, but didn't really think about it from this. Now that we have this digital record, how should we shift it from a paper record? Rather than what happened was what we did was duplicate what we were doing on paper versus looking at how could it be done. That's number one. And number two, there's massive companies that have developed these systems that shifting the entire industry to do things a different way takes money and time to invest in creating this technology. And then also converting people over. It's not in their best interest. It's in their best interest of keeping things the same. So I think that's shifting now. I wrote a book about this topic about a year ago. And at the time, nobody was discussing interoperability or data accessibility in dentistry. But now it's one of the most common things that I hear people talking about is this need to have our systems be interoperable. And I don't think I think it is because everybody's recognizing how big of an issue this is. It's been worked on in medicine for over 20 years, executed on very flawed manner. There's multiple issues. And so what we're trying to do both through, as you mentioned, standards and through the innovation is create a more holistic interoperability system within dentistry that hopefully medicine can benefit from.
Yeah, you brought up a lot of good points there. And of course, there's a lot of larger providers that have been in the space for a very long time where the incentive is never aligned for it to become more of an open architecture or open access, interoperable sort of solution. But I do think that fortunately it's changing. And, that's one of the things that we're pretty passionate about as well at Planet DDS is just having this opportunity to create really seamless experiences. And when you brought up like, hey, here's a paper chart, we're just gonna put this in the practice management, like, oh, maybe we'll do scheduling now, maybe we'll do this. I do think that the value of a practice management solution should be the core system of record that can be kind of the source of truth for a lot of information, but that information needs to freely flow out to other best-in-class solutions that practices can take advantage of to be able to best run their business. And I think that the incentive now for companies to do this is that if they don't, then they're going to fall behind companies like ours and like yours that are making these things happen. And there's going to be consumer choice, and they're going to choose the options that allow them to be most effective at running their business. And you've certainly played a really large role in driving that forward. When you look now at kind of technology, and you mentioned like, look, nobody was talking about this before. A lot of people are now talking about it. What are some of the things that you think dentistry should be most excited about that will be outcomes of having a more interconnected, integrated, open data access structure?
Another history lesson from the mind of Bryan Laskin to answer this, to give the high level answer, because to answer your question, I think we have to look at the history because it is very similar to like when practice management systems came out 20 years ago, roughly, right? What do you think this age of digital dentistry is going to do for dental practices? I believe right now that we're entering a new phase of dentistry, right? If I call it dentistry 3.0, because if dentistry 1.0 is analog dentistry, like four-handed dentistry, composites that work, adhesives, dental chairs that, you're laying the patient down kind of thing. Then we transitioned 20 years ago to digital dentistry, PMSs, CAD/CAM, digital x-rays. Now even the way AI is being leveraged today, I would argue is a 2.0 technology. Dentistry 3.0 is connected dentistry, consolidation of practices through DSOs, connecting more deeply with patients, empowering patients, medical dental connection, which is something we're very active with Toothapps. And then also interoperability, this communicating, these connecting seamlessly is what's going to enable everything else. Being able to directly connect with your patients whenever it's convenient for them. Right now in the year 2024, you can order everything from a car to a house to a spouse online in an hour, but try to make a dental visit, like a dental appointment. It's ridiculous, right? There's a taco shop that opened up just a few blocks down from my office, And before they opened, this is their third location on planet Earth. They had a big sign up that said, download our app. Why? Because consumers, now you can call them and order a taco. You can walk in there and order a taco. You can go on their website and order a taco. But the most direct way to engage with your customers, for us as dentists, with our patients, is going to be through the device that they're on, their nose is plugged into way too many hours a day, right? Is through their mobile application, And so that's how physicians today communicate with patients, through things like MyChart, which doesn't exist because Epic just loves patients and wants to hand over their data. It's federally mandated. This is not an option. It's federally mandated that you today as a dentist give patients their records, right? You might as well benefit from it. So I think that that's going to be the number one biggest improvement in dentistry, is having this connection directly with patients. I think it's going to be the biggest increase in case acceptance since the intraoral camera. There's one company that I work with, 3Disc, that's an intraoral scanning company. They have research that, because they also give the ability to share the scans with patients, their intraoral scans. And they show that for dentists that share their records with patients versus ones that don't, they get a 40% increase in case acceptance. 40. And that's just having a digital model of the patient's teeth. I think we're in this liminal moment where we're not just going to be doing digital dentistry in silos within the walls of our practice. I think we're going to be much more deeply connected with our patients. And then also things like being able to see if the physician has on record that they have diabetes. It's no news to anybody who works in dentistry that patients lie all the time, right? But it's critically important to know if that patient has diabetes. So I think it's going to be the biggest wave of innovation and elevation of care, certainly since the origin of digital dentistry.
Yeah, so it's a lot of removing of friction and increasing access, right? It's the ability to make everything easier, more easily understood on the patient end, and more readily accessible and available. I have to think that and I forget the percentage, but there's still a significant percentage of individuals that do not regularly visit their dentist. And engaging with dental practices historically has been maybe not the most pleasant experience that people have had. So this could have really big ramifications just for overall health of the population if we can make it much easier for more individuals to receive care and remove some of those obstacles in that taking place today, and then tying it more to the overall health connection with dental. I think it's a great vision for what things can be as we move forward. How much work do we have to get there? Like, how far away are we from kind of realizing and recognizing that vision?
We're there. I mean, so we've been working on this problem for 3 years, like you said, writing standards. There's a couple standards which are getting accredited right now, but the technology has already been implemented. So we're there. Now, I totally agree with you on, let's talk about a couple of the biggest problems in dentistry that most people don't want to talk about. And you just mentioned one. When I got out of dental school in 1999, right before the turn of the century, which makes me feel very old saying that, right around the turn of the century, about half the patients in the US didn't see a dentist regularly. Right now, today, 25 years later, it's still about half. We've done zero to move the needle on accessing people. Now, that's bad news. The other bad news is that if we actually did reach a significant portion of that population, we would be completely ill-equipped to handle them within the dental practices today. So we need both to reach those people and also improve our efficiencies so that we can actually see those people in our practices. Second to that, another horrible statistic that nobody even is really that aware of, roughly half or 47% of patients that get referred from a general practice to a specialist never go. So, and I know whenever I say this, dentists say, not in my practice. Okay, maybe it's 40% don't go. I mean, but you're not going to be at 5. I'm not at 5, but the systems haven't been in place to even track that, right? And so we as an industry have some either low-hanging fruit, you can call it, or embarrassing statistics is another way to look at it. And both are true, right? So let's capture those that low hanging fruit and put those statistics behind us, right? If our job as dentists and dental professionals is to increase the oral health of the population, how are we doing if half the people we refer someone don't go and we don't even see half the people, right? Those are some big problems that I think interoperability, even though it's kind of a not sexy, nerdy topic, it's directly addressing these issues.
I was actually thinking about this, and I don't know what the right answer is related to the percentage of the population that is not even seeing the dentist. And the referral piece as a separate item, the experience of being referred out as a patient in almost all offices today is terrible. It is like, here's this piece of paper with some stuff written down. Now you go call somebody that you don't even want to call to go do something that you don't want to do, with no accountability on how it's actually going to take place. And the people on the other end have very little knowledge as to whether or not you're actually even supposed to be calling them in some cases, because there's nobody closing the loop. So anyhow, that's my own pet peeve after like some of those experiences that I've had. But on the other side of it, do you think that there is an absence of education in our country or in the world at large as to the benefits that dental care and oral health have on overall health? And do you think there's any obligation of the government to have a larger role in promoting the industry itself, or the ADA, or, I think back on these commercials when I was growing up, like the stupid commercial where they put all the eggs in jail because they were like, cholesterol is bad. And okay, well, it was misguided and they were wrong. And so then they had to do the commercial where they let all the eggs out of jail. And we're like, oh, okay, we can eat eggs again. But I remember it stuck in your mind, and it was a very persuasive educational campaign that was run nationally to try to help the population understand something. I don't sense that we do those things to the same degree anymore. I'm just curious as to your perspective, if there is an opportunity there for there to be another approach where it doesn't just all land on the shoulders of the private practices and the DSOs and the groups to solve that problem of that big treatment gap.
Yeah, I couldn't agree more. But I would also say that I think that there's a lot of work being done, right? So I lead standard development at I'm a co-chair of a work group at the ADA, but then also through another standard development organization, Dental Standards Institute. And actually next week I'm going to be on a panel. It's called the Government Birds of a Feather a meeting, where I'm going to be on a panel with the head of the dentistry for the DoD, the IHS, the ADA Standards Committee, and then moderated by for the first time, we have a chief dental officer for the United States of America, Dr. Natalia Kalmers. It's great. And I know that the ADA, Dr. Kalmers, like pushing for an oral health initiative from the White House. So I think this is being done now. I think that what's happened is that everybody's recognizing that there's some data showing that oral health is the gateway to overall health, which I definitely believe to be true. Now, I think that connecting our record systems will be able to show what's the causation, right? Now we can see the correlation, but nobody's actually been able to tell what is actually the causation. We're actually going to be showcasing plugging our dental system into Epic this weekend. And then we'll be able to make these connections between medical and dental and actually showcase what's actually going on. Because right now, while we all recognize that the mouth is part of the human body and that there's these correlations, there hasn't been enough research showcasing that. But I agree. I mean, this is going to require, like, educating the population is going to require all of us. I mean, this is not a one-trick pony. It's going to require, hopefully there'll be a government initiative on oral health, and I think the ADA is working hard on that. If you want to get involved with that, be sure to let me know, because we can. The more voices that we can get pushing this, the better.
Yeah, that's very cool. I had no idea. So and this is a little bit above my experience, but I know that there's always been the Surgeon General, right, as a position as like the chief health officer, I believe, for the United States, and that there had never been a chief dental officer before, or a lead dental officer. role. So this is new. This is a change that has taken place in the not too distant past.
Yeah, I would say that that's what I've been told by the people on the panel. So I haven't fact checked it, but I know who she is. I know she's great. I know that she's doing really good work towards interoperability is a big focus for the federal government too, and for the DoD. Because if you're think about it, if you're a dentist in the military and you refer to a civilian endodontist, you need to make sure that this is, that patient goes for them to be, so that they can be deployed, right? So it's a big issue for the federal government too.
So what are some of the things you're working on right now with Toothapps? You said, hey, look, we're there right now. What are you maybe most excited about coming up over the next 3 to 6 months? And maybe what is still something that you find frustrating in your quest for, really creating this industry to become more interoperable and more interconnected from a data perspective?
So number one, I'm most excited about our patient application, which is kind of like my chart, but for dentistry. So it's federally mandated. The entire industry is out of compliance. And I think it's going to be the biggest elevation of quality of care and really driving revenue to dental practices because of how it's going to completely change how patients view dentistry, right? I think that there's a big disconnect between the way we as professionals view dentistry and the way patients view dentistry, and having the same information, being on the same page is vitally important. And this is, for the first time, shockingly, the first platform that reaches the biggest pool of people in dentistry, which is our patients, directly going to our patients and enabling their care through their fingertips. So I'm very excited about that. And the biggest barrier that we have, I've been spending the last 3 months being able to remove access to data by default, because I have dental practices saying to me, we can't share our treatment plans with patients because then they'll go somewhere else. Really? You're worried about a patient getting a treatment plan and going somewhere else. So now we have it so that you can actually, by default, not display data to patients. And, I understand that anytime there's a change, people fear change, even when it's in their best interest. And that's what I see going on right now. I see dental practices being fearful of doing what's right, what's mandated, and what's in their own best interest, which is sharing information with patients. I think we're going to, like, those dentists are going to look back in 5 years and just think, why didn't I have patients have access to their treatment plans so they can get third-party financing when they're talking about the multiple treatment plans at home with their spouse? So as with any inventor, probably my biggest frustration is the glacial pace that change can take sometimes.
It's like that with everything. We offer a function, many companies do now, where you can self-appoint, self-schedule, and many clinicians and doctors like, no, I don't want to lose control of my schedule. Like, no, you don't have to. We do think of different things that allow you to maintain the control while still offering the convenience to your patients. Like, it doesn't have to be all one or all the other, but yet it still becomes this scary thing, while providing a real benefit to people that are able to schedule when it's 10 o'clock at night and their tooth hurts and they don't have anybody that they can call, and they just want the peace of mind that this can be fixed first thing in the morning for them. So it is interesting, kind of the resistance to change. And even in the example that you just gave, like taking a treatment plan and then being concerned that somebody's going to go and get the treatment elsewhere, you should have enough confidence in your connection with your patients and in the way that you care for your patients, that they're going to prefer to work within your practice. And quite frankly, if you're concerned with somebody getting a second opinion or something else, that speaks to, I think, even larger issues. And it's pretty common in all over the country, whether it's at an auto shop or at your doctor, people like to ask other people as well occasionally. It shouldn't be viewed as a threat. So hopefully those are the types of barriers that get broken down over time. And it elevates just everybody's game. Just makes you have to be better at the end of the day.
It's also self-fulfilling prophecy, right? If you're worried about people going somewhere else and you don't want to give them their information, you're not going to be as trustworthy. So they're more likely to go somewhere else too. I also have empathy for dentists that are going through that, because, man, I remember we had the old paper calendar with a pencil where we used to schedule people when I got my first practice, and we had to transition to a PMS with a schedule on the computer. I was freaking out. I mean, I look back on it now, but so I've been through so many cycles of that I'm kind of numb to it. Right. But it is scary. I mean, I understand that change is scary, but like you're saying, I mean, it is, that change, those implementing those improvements for patients' experiences. I talk to tons of dentists, and many dentists I talk to, they're really excited about technology, and they're thinking about something like a 3D printer. I have a 3D printer. They're great. Okay. But if your patient can't, to your point, schedule an appointment online or pay their bill online or do any number of things that you could do from a Starbucks app for your practice, that's going to pay for hundreds of 3D printers, right? So if you, when you're looking at technology, instead of staying hyper focused on what, as a clinician, expand your viewpoint to what the patients are experiencing in your dental practices, I think that is what will drive impressive growth within your practices.
You made a comment a little bit earlier about the way that AI is being implemented in practices right now, from your perspective, is still very much Dental 2.0. What turns that into Dental 3.0? And as you think about what AI could actually mean for dentistry in the future, and I recognize this is largely just an intellectual exercise because there are still many gaps to achieving the promise of what AI could be. But as you think about it, what are some of the applications that you find most interesting that you think will provide the most value in the future?
That's is what really gets me excited, right? So what we're unveiling next month, so in a few weeks, you're going to look at your schedule within Toothapps and see a percentage number on each patient. And it's the probability that they're going to show up for their appointment. And then we're going to be using AI to increase the probability for them to show up for their appointment. So for that individual having that procedure at that time, what's the content, cadence, mode of communication that's going to be more likely for them to either say yes to treatment, to go through with treatment, how we can get them engaged in their dental care. To your point before about educating people, right? This is an individualistic exercise that AI, this is part of connecting with our patients. So connected dentistry, that will be a 3.0 version of implementing AI. Also, what we mentioned before, connecting with a medical record to a dental record or records, taking all the research study that's been done in medicine and all the research studies that have been done in dentistry and do cross-linking and looking for causation. We'll be able to unveil new connections that nobody ever looked at because it's so hard as a human to go through thousands and thousands of studies and millions and millions of data points and make these connections. AI will be able to do it in an instance, right? So everything from remote care to your individual practice, like what is for that patient. We did a study at Opera that showcased for this patient, what are the top 3 things that you could say to them that would make it more likely that they're going to go into a smoking cessation program? We're also going to be unveiling within the next couple months, when a patient calls into your office, for that patient, that procedure, here's the number 1 spot where you could put them for your profitability, number 2, and number 3. Those aren't academic exercises. Those are things that we're actively working on now, either that are coming out or that, the research studies will require access to bigger data sources, but we're getting there. Yeah. So I think those are the things that we're actively working on right now that I'm excited to use AI for a 3.0 style of technology versus, and the reason why I say that the way it's being leveraged today is a 2.0 technology, because we're typically speaking having AI do things that a human can do, saying there's caries on that tooth. Well, I could teach a patient to read radiographs and where there's decay in a couple hours, right? So we don't actually need to have AI do that, or yes, it's better and it's great to colorize it from a patient experience perspective. I'm not saying anything negative about the AI companies. They're doing great work. However, it's 2.0, right? 3.0 is doing things that humans can't do.
To me, the one of the biggest benefits of the radiographic AI is like, I just wish my dentist had it, because I want to see my x-rays in a way that I can understand without having had to go through that training. And it just is a credibility bridge that is built between the provider and the patient, where it's like, hey, this is what I'm telling you. And by the way, here's corroboration on that same thing. Doesn't mean that I don't have faith in my dentist. It's just a matter of having this kind of additional context that will probably greater incentivize me to get the treatment done that I need. But a great call out between whether or not it's something that a human's able to do versus not, as the differentiation between 2.0 and 3.0. And to your point with the predictive scheduling application that you're discussing, like, that's really great. That's an awesome application to provide a real meaningful benefit that would not easily be ascertained by a front desk staff or an office manager to determine, unless she just knew that, Sally Jones was notoriously a flake and didn't show up to any of her appointments. And she's like, oh gosh, it's Sally. Let's make sure I call her again. This solves that problem in a really interesting way. So I love those types of applications for AI. It's going to be interesting to watch. So last question for you, as you think over the next year, you're involved with ADA, you're doing interoperability, you're writing standards, you're building a lot of these kind of AI models yourself that are going to exist within Toothapps to help both the practices and the patients. What are you most excited about just as an industry? Like, I think that there's a lot of, I don't want to say negativity. I think that in general, people are very bullish on the prospects of dental still, though we've faced a relatively challenging time over the past 12 to 18 months where growth hasn't been as strong, and it feels like a lot of compression. Prices are higher, reimbursements are lower. There's just it's a challenging business to navigate for many people right now. As you look forward, what are some of the things that just make you optimistic about the industry that we are in and the prospects for dentistry?
First and foremost, I'm a dentist, right? And I have a passion for the clinical delivery of care. I do that now. I support that through technology, but I feel like we've been through a phase in dentistry where there's been a lot of dentists asleep at the wheel, kind of running practices as a hobby. And then we've had, on the other end of the spectrum, financial people who are getting their hands in our industry. And I see that coming together. I see people recognizing, because of the way the capital markets have been, that just buying practices and then letting them wither, but putting them and then reselling them to another company that's been problematic. And I see dentists who are asleep at the wheel of their business going, well, I'm getting buried by these companies that know how to run a business. And so what I'm most hopeful for are for entrepreneurial dentists, right? If you are an entrepreneurial dentist, I think you have three phenomenal options today. You can focus just on dentistry and not pay attention to your practice at all, have somebody else manage it. You can grow practices or do crazy stuff like we do with technology and not see patients, and that's a phenomenal career. Or you could do a blend of both. And so I think it's a phenomenal time to be in the actual delivery of care in a dental practice. We're going to be able to automate all the boring, laborious, stupid stuff that we're trying to force humans to do in practices that are understaffed, right? That should be a historic problem. So if you are actually a human being working in a dental practice, you should be able to focus on delivering the best quality of care and have a great career. And if you want to do something outside of that, I think you should have a great career. And so I think this sort of which is my personal passion, this merging of art and science and business, and where however you want to do that, I think it's a great time to be within dentistry as long as you play to your strengths.
Lots of positive opportunities out there for sure, for the right people that take the right approach. Bryan, I've really appreciated having you on the show today. How can people find you? How can people find Toothapps? Anything else that you want to share?
the best way to find Toothapps is go to toothapps.com, TOOTHAPPS. Or if you want to get a hold of me, it's my name, BRYN, so Bryan with a Y, at toothapps.com.
Thank you so much, Bryan. Appreciate it. The Dental Economist Show is brought to you by Planet DDS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. Thanks for listening.